Earlier this year, as COVID-19 spread beyond China, countries in Europe quickly became the next epicenters for the pandemic. Today, those countries that locked down early are seeing the benefits. But as restrictions start to ease, what the data points are telling us in terms of confirmed cases versus COVID-19 deaths will be crucial to understanding the likelihood of a second wave in Europe. I'm about to talk remotely to Dr. Mathias Goyen, who is GE Healthcare's Chief Medical Officer for Europe, to get his perspective on the way that COVID-19 has impacted the region's health and what Europe might look like in the upcoming months.
Dr. Mathias, it's brilliant to be on with you. And I couldn't think of a better person really to set the context for season 2 in terms of the data points and the science. So, I mean, kicking off right from the very beginning, COVID-19, where is Europe at with it as we speak?
Well, Mikey, Europe is a very diverse region with like 44 countries, and the impact has been significantly different from one country to another, I would say. I think it's safe to say that countries with an early lockdown are now seeing the benefits of doing so. And we're just 6 months into the COVID-19 pandemic. And while we've learned some things about the virus, there are still a lot of unknowns. For example, we still only know very little about the future impact of COVID-19, right? On the one hand, we see countries where people are trying to quickly return to a pre-pandemic way of living and working. Quite frankly, I doubt this is ever going to work. Other countries are dealing with a substantial increase in cases, not only in the US, but also here in Europe. I think our experience with COVID-19 greatly depends on where we are living and working, and every location looks a bit different.
Do you think it's still too early, though, to really tell whether various measures or various easing of rules have actually worked?
It is too early to tell. And you know, everyone is fearing of a second wave, right? I mean, you hear it, everyone talks about it. And the problem really is probably it's not a second wave. Probably it's more like a forest fire, right? Meaning wherever there's wood to burn, the fire is going to burn it. I mean, we've seen local outbreaks in Europe, and also let me give an example. In Germany, only last week, we had to reimpose a lockdown in an area only 100 kilometers away from here, and because we saw a spike in cases. It was in a meat packing plant where more than 1,500 workers have tested positive. So unfortunately, we have to get back to a local lockdown, and this is, of course, a situation you would like to avoid.
Doctors and medtech providers, these are the individuals that have been right on the front lines of COVID-19 ever since it breached China's boundaries, okay? What are they seeing? What are they witnessing? What are they observing? What are they learning that we're not hearing about through the media?
Right. I mean, I think the entire medtech and also healthcare industry has been heavily impacted, right? Healthcare systems were under stress, and we probably didn't see these kinds of overflow situations that we saw in China, but many elective and also more urgent cases were postponed. And what is striking for me, by the way, is that many of the emergencies have disappeared too. Heart attacks and strokes, of course, continue to happen, but doctors don't see them. And there are scientific reports indicating that there is an up to 60% reduction in admission for those emergencies. And the most likely explanation is that people simply stay home and suffer rather than risk coming to the hospital and getting infected with coronavirus. I just read this morning that the US National Cancer Institute warned that mammogram and colonoscopy screening delays could lead to like 10,000 additional deaths over the next 10 years. For me, it's simple. COVID-19 makes people fear of face-to-face medical care. And as a result, many people with urgent health problems remain at home, then call for help. And this is a clear wake-up call for the entire healthcare industry that we need to build and invest in a modern, digitalized healthcare infrastructure. And we've seen what has worked over the last couple of months, right? I mean, and I think we have to even become more digital in our offerings.
What has really stood out for you in terms of the way that previous medical technology has been now applied to COVID-19, and what should we be looking out for in the future?
What we've seen is that medical imaging equipment has been a big help, of course, in understanding a disease that 6 months ago, quite frankly, no one knew about, right? And for example, ultrasound, and I love this example, there's kind of a renaissance of ultrasound. Doctors are now using ultrasound to assess the lungs. I learned in medical school you cannot use ultrasound for the medical lungs because air is the enemy of ultrasound. But I mean, with the evolution of ultrasound machines, you can really assess the involvement of the lungs. You can look very nicely and very quickly at the heart, because we know that COVID-19, unfortunately, can also affect the heart function. So with ultrasound, you have a tool where you can, at point of care, at the ICU, you can make a quick diagnosis. And sometimes CT might be a bottleneck, if there is an overflow situation. So CT is not available. So what are you going to do, right? And this for me is something that I'm really amazed about, that ultrasound is now coming, is coming in a big way back, I would say, diagnosing it as a follow-up tool for COVID-19 patients.
Dr. Mathias, brilliant and fascinating insights into where we're at right now, especially when it comes to Europe. Thank you again for joining me on season 2.
Thanks a lot for having me.